Intermittent urinary catheterization for Jane Doe. This slide presentation will teach you the skills necessary to perform intermittent catheterization on Jane Doe every day so that she may continue to attend school. I will go over each step and then you'll have an opportunity to practice until you feel comfortable and competent. This is a nursing task, so I will be responsible for this task and I will review the procedure with you on a regular basis. Since Jane does not have the capacity to control emptying her bladder, she will need intermittent catheterization so that she may continue to attend school. What is intermittent urinary catheterization? Placing a tube into the bladder or urostomy to remove urine when the child does not have the capacity for controlling bladder emptying. What supplies will be needed? A hand towel, a catheter, a calibrated container to collect the urine, water-soluble lubricant such as KY jelly or Surgilube, never use Vaseline, liquid soap, water, paper towels, vinyl gloves, plastic Ziploc bag. All of these supplies may be found in the clinic. What are the steps of urinary catheterization? First, ensure that the doctor's orders are clear and in place. These orders should be clear regarding the frequency of catheterization, the technique to be used, and how often to change to a new catheter. The orders should also state whether any urine collected should be recorded. Wash your hands thoroughly with soap and water. Assemble and prepare the equipment on a paper towel placed on a clean surface. Make sure the items are arranged so that you can reach them easily, but they will not get knocked over. Put on clean vinyl gloves. Help Jane to lie down on her back with her legs butterflied, spread apart with her knees bent, so that you may easily access the urethral opening. First, though, make sure that you've arranged for privacy for the student. This is a picture of the legs in a butterfly position. Locate the urethral opening by opening the labial folds, or lips. The urethra is located above the vaginal opening. Clean the urethral opening and the surrounding area with cotton balls. Use a clean cotton ball each time you wash the area. Liquid soap and water are sufficient to clean with. Make sure to wipe from top to bottom, the urethra to the anus, never the bottom to the top. 3 to 4 wipes should be enough. Generously lubricate the tip of the catheter with water-soluble lubricant and make sure that the open end of the catheter is in the calibrated container. Only use water-soluble lubricants such as KY jelly or Surgilube. Never use non-water-soluble lubricants such as petroleum jelly or Vaseline. If you do not have any available water-soluble lubricant, you may use water. Insert the catheter gently into the urethral opening using steady pressure until muscle relaxes. Insert the catheter until you feel some resistance. This is the opening to the bladder. Advance the catheter until there's a full stream of urine. Have Jane bear down or crede the bladder if needed. You should push slightly past the resistance until you obtain a full stream of urine. If you're having difficulty obtaining a full stream, you can have the student bear down as though they're having a bowel movement. To crede the bladder, gently push downward on the abdomen above the bladder. Once the bladder is empty, withdraw the catheter slowly and clamp off the catheter before removing it completely. Help Jane to dress and return to class. Wash, rinse, and dry the catheter and store it in an appropriate clean container. Use liquid soap and water to wash the catheter and the cup and water to rinse them. Store the catheter and cup in a clean Ziploc bag. Measure and record the amount, color, and character of the urine and dispose the urine in the toilet. Dispose of gloves and wash your hands. For example, is the urine light yellow, dark yellow, orange, red, etc.? Is it clear or cloudy? Are there particles floating in the urine? Do you see blood or mucus in the urine? Communicate any signs of infection, swelling, bleeding, bruising, tissue damage, or blockage to the school nurse, family, and the doctor. Special considerations. Always make sure that you provide privacy for the student. Encourage the student to help with catheterization whenever possible. If physically able, we ultimately want her to become sufficient at catheterizing herself. Students who cath frequently have cloudy, foul-smelling, and sometimes bloody urine. However, if it's consistently cloudy, foul-smelling, and bloody, this is a concern. Other concerns include pain during catheterization or in the lower back, burning, pus in the urine, fever, and little or no urine output. Many students who require catheterization also have constipation or stool leakage. If you have questions about catheterizing Jane or the doctor's orders, always contact the school nurse before doing anything.